For today's EMN5, I'd like to talk about START triage. The system of triaging became pretty well established on the battlefields during World War I, where it became the practice to sort soldiers according to the severity of injury. The START triage system, which stands for Simple Triage and Rapid Treatment, was established in 1983 as a system for first responders and EMTs to use in a disaster or mass casualty situation. It provides a pretty simple algorithm by which to triage many patients quickly in the field, and then people are actually marked in the field by the triage person with a color-coded tag that the disaster team carries with them. And then they're physically sorted into locations by that color coding where they can be treated or evacuated based on their color. So red, yellow, green, and black are the categories that we are triaging patients into. So let's take a look at what each of these means. So red is immediate, meaning they have a life-threatening injury that's probably survivable if they have immediate medical treatment. It also includes public safety personnel, for example, injured firefighters or EMTs, or patients that are hysterical that can be very distracting to the rest of the triaging process. Yellow is considered delayed. These are patients whose care can probably be delayed for a couple hours. Green is considered walking wounded. These are patients whose care can be delayed for up to 8 hours. Now, one category that I think is particularly hard for us as medical professionals, especially in the ER, is black. This is considered the dead or not breathing. We are used to patients coming in who have no pulses, who need an airway, who we resuscitate for hours in the ER. But the difference here is resource management. We have potentially hundreds of patients with poor resources. And taking the personnel and materials away from, say, 5 red patients in order to do chest compressions or intubate someone in the field is just not feasible. So as far as calling a death or a black in the field, we're no longer using the EMS rules of asystole 3 leads, rigor mortis. In START triage, it's anyone that doesn't have a pulse or who is not breathing spontaneously. You get one attempt to reposition the airway, but if there's still no spontaneous respirations, you mark them as black, meaning dead or expectant, and move on to the next patient. There is, of course, a caveat to this, that if you do have the resources, you could consider palliative measures or possibly some resuscitation. So personally, I think it's easiest just to remember the categories. As medical professionals, especially in the ER, I think we're pretty good at looking at someone and knowing how soon they need medical attention or if they're sick or not sick. But the algorithm works really well through those decisions based on a few simple questions and vital signs, which is pretty nice because it's a helpful reminder, especially in really stressful situations such as a mass casualty. So first, we ask ourselves, can they walk? If yes, then they're green. So that's pretty simple. You can even announce that to the crowds. You can say, anyone who is available to walk, please move over to this designated area. That automatically separates your greens and also clears the field a little bit to make room for the rest of triaging and make it a little easier for yourself. Next, you ask, are they spontaneously breathing? If no, you reposition the airway once, and if it's still no, then they're black or expectant. If yes, then they become a red. Next, you assess their perfusion and respiration and neuro status. For example, are they tachypnic? Do they have good pulses and perfusion? Any signs of shock? And do they have an intact neuro status? For example, will they follow commands? If it's no to any one of these, they become a red. If yes, but they can't walk or have a significant injury, then they're yellow. And here's a simplified version of the algorithm. Again, green is the walking wounded. The expectant or black is no respirations after 1 airway repositioning. The red or immediate is respirations over 30, poor perfusion, no radial pulses, or not able to follow simple commands. Everyone else becomes a yellow or delayed. So 3 to remember, START triage is for mass casualty or disaster situations. Again, we talked through the green, yellow, red, and black algorithms. And lastly, just note that START triage is different from triage in ER. There's no CPR and no intubations. Remember, in this situation, your patient becomes the crowd, not just one individual. You're trying to save as many people as possible using the limited resources. Here's some references, and thanks again for joining us on EMN5.